Hope you guys are doing great. This is Dale, and she's going to teach us what she knows about forensic nursing. So good morning, Dale.
Good morning. Good morning to everyone.
Thanks for joining us, Dale. I'm glad that you took some time to teach us everything that you know. So how long have you been a nurse?
I've been a nurse for about 22 years. This was a second career for me, and I went back to nursing school when my kids were in school.
Wow, that's awesome. So what led you to forensic nursing?
Well, I've always been interested in women's health and safety. I've had multiple friends who've been victimized in various ways. And when I went back to get my BSN, I had an associate degree. My clinical rotation was with the Sexual Assault Center, where I ended up working. And I just became fascinated by it and went on to do my master's in forensic nursing.
Okay, very interesting. And why do you prefer this job over other specialties?
Well, I like being able to help people who are in crisis, in a different type of crisis than people with health issues. And I like not knowing what's going to happen next, what I'm going to be faced with next.
So did you work in like a clinic setting or a hospital setting?
Our clinic, and I was there for 11 and a half years before I retired a month ago. Our clinic is based out of a hospital. So the hospital was our home base, but we also saw patients in 3 other emergency departments in our county.
Oh, okay. Okay. So can you give a detailed description of what forensic nursing is and what exactly your job entailed?
Sure. And forensic nursing is different for everybody. Every community or hospital or whoever has a program runs differently. So I can only base it on what we did. We saw victims of sexual assault, and that included all ages, physical assault, domestic violence, elder abuse, child abuse, sex trafficking, kids exposed to methamphetamines. And then when ordered by the courts, we would do evidence collection on offenders.
Wow. So did you see your patients on like a referral basis from the providers?
Our referrals kind of came from everywhere. We had referrals from law enforcement, from CPS, from the ERs themselves. Sometimes parents, our clinic was housed inside of a child advocacy center, and parents would sometimes find our number and just call us. And so we tended to get referrals from everywhere.
Wow. Okay. So any advice on landing a job in forensics?
Well, that's a really tough one. And first I have to differentiate between forensic nursing and sane nursing. Sane nurses only see sexual assault victims. We see everything. The best thing to do is really to try and read about as many types of violence as possible and learn about the signs for different things such as elder abuse and child abuse and those kinds of things. Ask a lot of questions. If you can hook up with your local sexual assault center or forensic nurse center or whatever that you may have, if they'll let you shadow. In some places, we used to do that all the time. But if they'll let you shadow with them, it gives you a firsthand look at what you're going to be dealing with on a regular basis. And a lot of nurses go into it thinking that it's like what you see on TV on CSI and stuff, and it's really not that glamorous. It's more down and dirty. And so it's really important that nurses who go into this understand that it's a very traumatic area of nursing.
So how did you as a staff take care of yourselves in regards to that emotional and taxing part of your job?
Well, I think first of all, we had to realize that it was an emotional taxing, secondary trauma is very real for all nurses, but we dealt with violence on a day-to-day basis. And so for us, it was really difficult. So we would talk to each other a lot. In the clinic, my door was always open, as was our nurse practitioner's door. So our nurses could come in and just vent or cry or whatever they needed to do to get through something. We also would periodically do fun things, like we'd go out to dinner as a group, as many as possible. We had a chaplain who comes in once a month and debriefs with us, and he understands what we do, which is helpful. But you have to kind of keep as much of a balanced part of your life as you can, and know when you're in trouble and know when you need to talk to somebody to get out of that emotional trouble.
Yeah, so those debriefings took place monthly. Is that common in forensics, or are you is that specifically obviously to your area, but do you know if that's something that's common practice in forensic nursing as a whole?
I know that other groups have told me that they do debriefing, but I don't know how many of them actually use a chaplain to do it. So I'm not really sure. And this is something that was relatively new in the last year and a half or 2 years for us.
Okay. Wow. So you stayed 11 years and only had those support services available to you the last portion of it sounds like.
Correct.
Wow. That's impressive. I think I would struggle with that maintaining of my emotional clarity, I guess.
Yeah. And it's true with forensic nursing. I talked to several of our nurses about it. It's a job that really changes you. It makes you a different person than you start out. You become a lot more jaded, really quickly. But, that being said, I loved it. I still love it. I just knew it was time to retire, but I'm hoping to do something in the area of forensic nursing in the future, too, because it's just such a fascinating field.
Interesting. What are you thinking to do?
I'm not really sure right now. I've gone to a couple of our local colleges and universities and spoken about forensic nursing, and that might be something I'll do. I'm just kind of playing with options right now.
Okay, very interesting. So someone asked what the difference between forensics and sane nursing was. Did you have anything else to elaborate on that, since you already covered it a little bit?
No, it's pretty much just that the sexual assault nurse examiners basically just see sexual assaults, and some of them only see like adolescent and adult. Some see all ages. It just kind of depends on the facility.
Okay. A nurse submitted a question that said, I'm interested in the OMI area of forensic nursing. Any input on this specific area?
If they're talking about death investigators, I know very little about it. When I was doing my master's, I did an internship with one of our local medical examiner's office, and was fascinated by it. And I was talking to him and said, you really should hire me. And he said, I can't afford you. So I know that a lot of our nurses are interested in that, but I don't have a lot of firsthand experience with it.
Interesting. So I wonder what backgrounds or degrees they commonly use if they can't afford nurses.
I'm not really sure, because the death investigators that I talked to when I was doing my internship, I'm not sure. I don't know if they have like criminal, something in the criminal field as far as their degrees are, or if they even have degrees. We didn't get into that, so I'm not really sure. And once again, I think that's something that would depend on the location, wherever you're at. Yeah.
Okay. So what is something you commonly encounter? If you could give advice to a student interested in forensics, what would it be? So I think she was asking, like, if I could focus as a student on a specific area of forensic nursing, what would it be if she wanted to focus her studies?
Wow. It kind of depends. If they're interested in solely doing sexual assault, then I would just say read anything you can get your hands on, talk to prosecutors, talk to police, talk to other SANE nurses. And if it's more of the forensic area, the same thing. The more knowledge you have, the better. It's one of those things that it's really difficult to pinpoint exactly the best routes to go, but forensic nursing is changing so fast that it's just a matter of trying to keep up with all the new stuff coming in. And going to the International Association of Forensic Nurse website is a good place to start.
Okay. So is there anything like specific that you commonly encountered, whether that was elderly abuse or child abuse? What was your most common case, I guess?
Well, it used to be sexual assaults, but in the last year and a half, 2 years, it's been more of the physical assaults. We were getting a lot more of those. I used to run the stats for our clinic, and we had gone up from like 10% of adult physical assaults to 60% in a year and a half.
It's a huge jump.
It is a huge jump, but we just kind of see a lot of everything. We were starting to see a lot more motor vehicle or car pedestrian accidents because we never knew if they were, intentional or accidental. So we were called in on those.
Okay.
Probably physical assault was our biggest in the past several months, or at least.
Okay. So what did you do prior, and how did it prepare you for being a forensic nurse?
Well, ever since I graduated from nursing school, I've been a pediatric nurse. So I started out in a school nurse, and we had some interesting children in the school. It was an elementary school. So I kind of got a feel for it then, although I didn't realize it. And then I became a pediatric nurse and then a pediatric charge nurse at a local hospital, and dealt more with the and it just became a matter of trying to figure out how to work with people who were in crisis. And, a lot of them were parents who were angry about one thing or another. And so I had to learn how to deal with those types of situations, which helped me when I went on to do forensic nursing.
Okay. So would you suggest that someone that's interested in forensic nursing go ahead and start in peds, since that's, I feel like people either are comfortable with kids or they're not. And so maybe getting more comfortable with kids, since you will definitely be seeing kids.
Well, it doesn't hurt, but our nurses come from a wide variety of backgrounds. I mean, we have ER nurses, pediatric nurses. Okay. We have one who's a school nurse, psychiatric nurses. They just kind of come from everywhere. So it's more of a matter of, how comfortable you are learning about how to work with kids if you don't have a kid background.
Well, the next question I feel like you kind of answered, but maybe have something to elaborate. What area of nursing, ER, ICU, community, etc., would be best prepare you for getting into this area of nursing?
I don't think one is necessarily better than the other. The big advantage with ER nursing is they see a variety of things there that maybe someone else in school nursing or psychiatric or something might not see, but they see something too. I mean, every area is beneficial as far as learning. I think the big thing is you have to be willing to learn and to use really good critical thinking skills, and just kind of ask questions and look for help when you need it.
Yeah, having a very wide variety of team members, it sounds like it'd be really helpful, and specifically with forensic nursing. But I feel like psych would be really helpful.
Yeah, with the number of mentally ill patients or people who are wandering around the streets, no matter what city you live in, psych is really beneficial.
Yeah, I could see that. So what qualifications or certifications are needed for forensic nursing?
Well, I can't speak for other areas, but for ours, you had to be a registered nurse. You cannot be an LPN. So as long as you have an associate degree, we do training. We train our nurses 40 plus hours of classroom plus shadowing with a trained nurse before they're let loose. And then there's always somebody in backup for you, so that if you have questions or concerns, you can call them and they'll either deal with it over the phone or come in and help you.
Okay, so even an associate nurse or a bachelor's degree nurse could qualify for forensic nursing, and you're in Washington, so that may differ based on where you're at statewide, right?
Correct.
Okay, well, that's good. I didn't realize that. I thought it was actually master's trained nursing.
No, in fact, we have several nurses who are going through their master's right now, but up until the last few years, most of our nurses were associate degrees.
Okay. Good to know. So is forensics a good place for a new nurse to start, a new grad to start? And if so or not, can you elaborate?
A couple of years ago, I would have said no, but a few years ago, we hired a new grad nurse, and she's amazing. She's just awesome. So I think it really depends on the person. Okay. Some are great, and we have had nurses who tried to train with us who had been in nursing for quite a long time and had a BSN or something, and they just weren't good at this. It wasn't a career for them. And like any nursing, this isn't for everybody.
Right. So what characteristics make a good nurse in forensics?
They really have to be flexible because you never know what's going to happen. Good critical thinking, awesome documentation. That's really important in what we do because of the times that we have to go to court and testify. And just being able to debrief with others when they need to. A lot of nurses tend to keep things to themselves, and this is a job you can't do that. You have to be able to talk to other people or you'll go crazy.
Sure. All right. What are the characteristics? Oh, we already addressed that. Sorry. What kind of experience would be best to get under your belt if a nurse wants to transition into forensics, which you already answered, really? Pretty much any experience, right?
Yeah, and the other thing is one of the new grads that we hired, who's an amazing nurse, she had worked with us as an advocate. It was a non-medical role while she was getting her associate degree. And that really helped her transition into the nursing portion of it because she was able to watch what the nurses did and still function as an advocate for the patient.
Sure.
He swears by that.
That's amazing. And so as an advocate, what type of training do you need for that?
Advocates go through, let's see, what do? They go through training through WICSAP, which is the Washington Coalition for Sexual Assault Advocates, or I can't remember the exact time, but it's a 40-hour class as well. And then they shadow with a trained advocate, and then they go out as a team with a nurse to cases in the emergency department.
What a great opportunity for those that want to be in forensics to do an advocacy course and take that route. That sounds wonderful. I love that.
Yeah.
So what do you love most about forensic nursing?
The variety of cases, I think, is probably what I love most. I really loved not knowing what was going to happen. You know, no two cases are ever alike. And I love the people that I work with and the other agencies, law enforcement, CPS. It was just a fascinating job for me. And I have that type of mind that I like those kinds of things. When I was a kid, I wanted to be a cop. So this was the next best thing.
Awesome. So can you just paint a picture of what a day in the life of a forensic nurse looks like? You can give a sample case or something like that. What does that look like? What are you actually doing? What does that look like for you?
Well, I'll use a sexual assault case because it's probably the easiest. And it would be an adult sexual assault, not a child. So we would get paid by the answering service. What our nurses do is call into the service and find out what's going on, where the case is at. Then they usually touch base with the advocate and figure out who's going to get there first. They go to the emergency room, touch base with the nurse and sometimes the doctor for that patient, and then they go in and do a history of why they're there specifically. And we let them tell us. We don't insert any of our opinions or ideas. And if they say, well, he did it to me, then we have to find out, well, what did he do? We don't say, well, did he sexually assault you? Because that's too leading. We want them to tell us in their words. And then we do a general history of health concerns, where they live, those kinds of things. And then if they're willing, we do a head-to-toe physical exam. We do any type of labs they're willing to let us do for STDs. We treat them if it's applicable for prophylactically for gonorrhea and chlamydia, and if it's within 72 hours and they're not pregnant, we offer them Plan B. They have the right to accept or not accept any of those. They also have the right to kick us out at any time, and we tell them that up front. And then we make a determination whether or not they need to be seen in follow-up at our clinic. We make sure they have our contact numbers. How to get a hold of us, how to get a hold of the clinic, how to get a hold of our advocates in case they need it, and then, release them back to the emergency department. If they want us to talk to law enforcement, we have to get them to sign a consent for that. If we're going to be taking photographs, they have to sign a consent for that. So everything is is very open to them so that they understand that what they're signing for is what they get. And that protects both them and our nurses. And most of those cases take anywhere from 2 to 4 hours, depending on how long the patient wants to talk.
Interesting. So what warrants follow up in your clinic?
Injuries. So if she's got genital injuries from a sexual assault, we'll want to see her probably within a week to make sure that everything's cleared up. If she's been strangled during the course of the assault, we want to see her within 3 days. Our nurses will also talk to the doctors about advising them that we suggest a CT of the soft tissue of the neck, just to make sure there are no internal injuries to the neck that cannot be seen. So we want to make sure that they're doing okay. And then after the fact, sometimes one of my jobs in the clinic was to look at labs. So if I came across positive labs and we had or had not treated them, I would have contacted them and either get them treated and set follow-up or just set follow-up to make sure that they're doing okay.
Okay. Did your nurses ever present in court after giving evidence to law enforcement?
Yes, that's a frequent thing for our nurses. And it really varied nurse per nurse. Like one of our nurse practitioners who's been doing this longer than I have, she's routinely got 4 or 5 cases going in court at any given time. Our on-call nurses may not get in court quite as often, but they do go to court as part of the job.
Okay. And are you testifying in front of the jury, or what exactly does that process look like?
Usually it's in front of the jury. Most of the time we're called by the prosecutor. Occasionally the defense will call us, and we're fact witnesses. We just tell them what we see and what we're told. We don't present as expert witnesses, and we just go in and testify, answer their questions, and take off. And a lot of times we don't even know what happens after the fact.
Okay. So what does a typical caseload look like? Or is it just dependent on how many cases come in the clinic that day or called to you?
Yeah, it really does depend. There are some of our nurses work 12-hour on-call shifts and a minimum of 4 a month. And some of the nurses work more than that. And on any given day, they could have no cases whatsoever, or they could have 6 or 7 in one 12-hour shift, which makes for a very long day or night.
Sure.
And in the clinic, we generally saw probably somewhere around 4 or 5 days a week in follow-up or as new patients that were referred to us. So it was really variable depending on what was going on in the community at that time.
Okay. And is this a good, flexible career? Is that something that a working mom or something like that would maybe be interested in? Would you say that it's flexible?
Yeah, I think so. A lot of our nurses have other jobs, and this is kind of a secondary job for them. Their schedule is based on their availability. As long as they put their 4 shifts in a month, we don't care where they put them. Some of our nurses work a combination of days and nights. Some work only days, some work only nights. But yeah, it can be flexible, and depending on how busy you are, it can be good money.
That's great. And are you paid by the case?
Yeah, our nurses are paid standby time, and once they go to a case, they get case pay.
Okay.
Which is, I don't remember what it is now. I think they were going to raise it, but yeah, they get a base wage for case. So it doesn't matter if you're there for 5 minutes and the patient tells you to get out, or if you're there for 6 hours, it's still the same flat rate.
Oh, interesting. Okay. Yeah, that is interesting. So what do you dislike most about forensic nursing? What is the hardest part of forensic nursing?
Probably the secondary stress is the hardest part. It's really difficult to lose patients. We've lost a number of them, especially young children and stuff. To have them die is really hard on everybody, even for the nurses who weren't there in the emergency room at that time. It can be really stressful.
Yeah.
Probably the secondary stress.
Yeah, of course. All right. Well, do you have anything else to add about forensic nursing before we go?
Not that I can think of it. It's an amazing job. I'm glad that I did it and hope to continue to do it in some form. Uh, it's it's a really unique opportunity to learn about people and how they deal with trauma in their lives.
Yeah, that is really interesting. A viewer commented, I wonder if New Mexico has anything like this. Sounds like an intriguing field. And I agree. It does sound really interesting. I'm sure there's something like that available here. I know there's sane nursing here. I just don't know what else is available. But
Well, and I know our program started out originally as the same program, and then
okay.
The need started coming up that they wanted nurses to come in and see physical assaults and domestic violence and those kinds of things. And over the years, we've expanded because it was the same program when I first started with them. So.
Yeah. Well, great. I appreciate your time. I'm so glad that we got to learn what forensic nursing was about, and it was nice meeting you.
It was nice meeting you too. Thank you very much.
All right, Dale, have a wonderful day.
Thanks, you too.
Okay, bye.
Bye.